Good morning, everybody. My name is Dave Arland, and I am Executive Director of the Indiana Broadcasters Association. Coming to you this morning from Carmel, and we're about to connect Senator Mike Braun, coming from Jasper, Indiana, for this teleconference. My thanks to our members of the Indiana Broadcasters Association who are with us today to ask questions, as well as those who belong to the Hoosier State Press Association. We appreciate you taking your time this morning to help us and to be part of a discussion with Senator Braun. So here's how this is going to work this morning. If you mouse over your screen, there'll be a bar that comes up, and you can see right down here there's a chat button. When you click on that chat after the Senator's opening statement, there will be a chat window that opens, and you'll be able to type in your questions there. We are not opening mics because we know people are recording this morning. I'll pose those questions to the Senator. He'll have about 20 minutes with us today, and we hope you will participate. And so without further ado, please welcome Indiana Senator Mike Braun from Jasper.
Hey, thanks for doing this. It has been an interesting last month to 2 months as we saw the whole coronavirus looming on the horizon and then unfolding like it has across the country. Of course, it culminated last late on a Wednesday to where we got it across the finish line in the Senate, and then the House soon to follow. Unanimous vote in the Senate. Never seen anything like it, in the sense that when I look back to 2008, that was a systemic issue with the economy brought on by certain sectors where you could really kind of see the clear connection. Here, it's a clear connection as well. We've had a coronavirus, a novel one, throw the country into disarray from a public health point of view and in terms of our economy. In the time that I've been in DC, it was rare to see Republicans and Democrats, and I'm talking about senators in this case. We were in about 4 or 5 task groups trying to get something out with the urgency that demanded it. And then it did get held up with some of the standard political stuff that we've all become accustomed to, but did get across the finish line. This is unknown territory. We've had other viruses recently that we've contended with, nothing quite like this. And I do believe that until we tamp the disease down, the country is not going to be at ease. And it's a tricky dynamic in terms of how we do that and saving the economy and making sure that we don't do irreparable damage to it. And we've learned so much about it. I think in terms of how it's been done at the federal level, of course, we can discuss that. I'm sure you'll have some questions. I've been proud of how state and local governments have reacted to it. We will get through it. And when we debrief this down the road, I'm sure we'll find a lot that we can apply to when something like this might occur down the road. Happy to take any questions.
Okay, so let's go ahead and start. If you would, if you reach again down into the chat box and just click on it, you'll be able to type a question. And I'll just type a question here. This is how it works. And then everybody should be able to see what comes in. So our first question, Senator, is from Corrine Rose, and she says, how soon will tests be widely available across the state?
It's been the #1 question, not only across our state, but nationally. And that's such a good question because until we fully get all the data in, most of the experts believe that we could have up to 3 to 5 times as many cases out there that have not been tested. That means 2 things. We don't have all the information to isolate where the disease is at its worst. And we also need to relate that to the mortality rate, which has had everybody scared from the get-go when it looked like it was going to be 3 to 4%. When will we have tests? Eli Lilly, when I talked to the CEO, Dave Ricks, here a couple weeks ago, when they were going to throw all their resources behind helping here in Indiana and across the country. I know we've heard it again and again that it's going to be happening on the tests and the variety of them, to where we now have one that you can get the results in as little as 15 minutes. I feel comfortable that as we tackle this across the country. It was not there in time to probably adequately test for the focal point, the epicenter in New York, that we will get ahead of that. I cannot give you an exact day when anybody in Indiana that needs to be tested or wants to be. Right now, we're straddling the people that want to be that may not get tested due to current medical guidelines. I think that'll be a moot point soon.
All right. Senator, another question, this one from Dan Spaler at Fox 59. Do you support the president's move to extend social distancing guidelines through the end of April?
Yes, I do. And I think I also support the fact that he has looked at this, I think, in a somewhat flexible way. The disease is the most important thing that we've got to conquer. And he, along with many of us, have said that we also are going to have to look at what we do in the effort of that without, killing the economic patient. But I think one is the first priority. That idea of looking at the second question aspirationally and selectively across the country, I think is going to be the right way to do it. Social distancing and the simple rules of hygiene and quarantining when you need to. Everyone should be doing that, especially in densely populated areas. I agree with the vision, yeah.
Okay, a couple of questions about the economic stimulus package that went through. So a two-pronged question from two different people. One, will there be another economic stimulus package before Congress? And could you please assess the $23 billion in relief for farmers as part of that act, as it pertains particularly to Indiana farmers? Does it fall short in any way?
So when it comes to whether there'll be a phase 4 or 5, no one knows that at this point. If you extrapolate the current numbers into where this is going to settle in and how many cases we actually have, where that mortality rate and case number starts to flatten and then decline, that will be what drives whether we'll be doing another package. You got to remember, when it comes to everything that the economy is suffering from, it was just a little over a month ago, and we all were part of one of the hottest economies that the country has ever had. So everything we're doing is a result of the policies to tamp the disease down. And clearly, the more we adhere to social distancing, hygiene, and quarantine when you're in harm's way, I think we'll tell the story there. When it comes to any particular group, like farmers, everyone is being impacted by this. And the part you don't hear would be sectors like agriculture that's not directly related to the early shutdown consequences. Hotels, 2% occupancy rate in a lot of the hotels in Indianapolis. Came back on a flight here on Thursday morning, last Thursday, 6 people on a plane that had a capacity of about 60. 4 were airline employees, bars and restaurants. The ripple effect throughout the rest of the economy, the best I've heard, is off 15 to 20%. Most businesses are off 35 to 50%, and agriculture is not going to escape either. So I think every group, including farmers, have to be taken into consideration when we see what the policies have done to impact certain parts of the economy. And that's why we did a package that was going to address small businesses, 500 and fewer, through the SBA portal, and then general liquidity into the system for those businesses 500 and larger, and then individuals through the round of checks that'll go out in 3 to 4 weeks. Sadly, that's 2 to 3 times as quick as what we did it in 08. And then the unemployment insurance enhanced would be the most immediate way for people to get help that have already been laid off.
Senator, a couple of questions about readiness. What more can be done to get citizens to pay attention to the stay-at-home order? I think all of us rather surprised by some of what we saw over the weekend, not necessarily in Indiana, but churches that continue to meet, et cetera. But what is your advice to people?
I said, pay attention to that. As much as I do not like the fact that the government has had to move in a comprehensive way, it's necessary in this case. This is a national issue, even though Indiana does feel different from obviously the epicenter, New York. Thank goodness the travel restrictions were put in place early, or this could be a lot worse. And I do believe when you listen to President Trump about the aspirational side of when we can get back to normal, the more we learn about it, the more we see the curve flatten. I think that's going to be different for places across the country. So I say stick with it. We've invested 3 to 4 weeks in the guidelines that the health experts have told us to. We don't want to backslide. And I think the more we do that, the quicker we come out on the other end.
A couple of questions, very similar in nature here. Senator, you're a small businessman. And what do you say to small business owners in Indiana that are worried for their survival? What words of encouragement can you give? And, you know, what do you do if you're a CEO of a non-essential business, or for that matter, a CEO of an essential business? What should you be thinking about?
So a CEO of a non-essential business is probably going to be the one that struggles the most because you basically are going to have all the overhead and payments. And, you know, on the larger businesses, that's going to be quite a bit. Even the most healthy companies that have a line of credit, that came into this with a strong cash balance, they can probably go a month or two before they really have to start doing things that will drastically cascade people into the unemployment rolls. So a small business, very few of them have lines of credit. I've always said you need to get them when you don't need them, because when you need them, you probably aren't going to be able to get it. And sadly, that's going to be the case for most small businesses. So depending on how flexible you are, how low your fixed costs are, many will be able to get through, and especially if it's a business that's had some history to it, to where it did have cash balances. That's why that SBA portal and loans that reach employers 500 and fewer are essential, and I hear those should be accessible quickly within a week or so. And I'd advise any small business across the state, any large business as well, please contact our office. We've got a great constituent service team, and I've got a good team in DC and Indiana, and I think bring a special kind of perspective to how we get through this, coming from the business world so recently.
Couple of questions about what we all saw over the weekend. Surgeon General Jerome Adams says Indianapolis will be one of the next COVID-19 hotspots. So, Senator, knowing this information ahead of time, how will we make sure that we don't end up in the same situation as New York? I think many of us were struck this morning seeing temporary hospitals being built in Central Park. What can we do?
I think that should put the scare factor into everyone and other municipalities without, you know, getting to the point where, you know, you panic over it. When I spoke to the governor and our agency heads roughly 2 weeks ago, we at that point had roughly 3,700 hospital beds with ventilators. And so we had a big cushion. And I think everything that we've had the advantage of ahead of time, seeing what that worst case scenario could be, has hopefully put everyone at full alert. And that's why I think it's important. Again, Indianapolis is somewhere around a top 14 or 15 metro area in the country. It needs to do everything that we've learned that New York has had to learn the hard way, because it was hit first. So I think in talking to the governor, our agency heads, that I feel comfortable that we'll navigate through it, and that our state has done what is necessary to hit it, you know, confront it full on.
A question here about the military. Will Congress consider mobilizing the military to build temporary hospitals or be used for other help? And I would note that we know the Indiana National Guard has been helping in food banks and other things too.
I think the military definitely needs to be on guard and used already where it has been. National Guard especially has come into play on many national emergencies. And I think in places even like New York, if you need the active component of our military, that you need to throw everything in the kitchen sink at it. These individuals across the board have got special preparedness for it. And I think, yes, we shouldn't spare any resource to try to tamp this thing down. I think that largely is going to occur in places where, it gets out of hand. And hopefully we won't have too many other instances like New York City and the state of New York. Although you can see New Jersey has now fallen into a category very similar due to that proximity. So whether it be Chicago, whether it be Indianapolis, whether it be Dallas, any urban area needs to plan like for the worst so that they're prepared in any fashion to confront it when it gets there.
All right, we've got about 5 more minutes to go. So if you have a question, this is a good time to ask it. A quick clarification, Senator. Were you referring on the number of hospital beds with ventilators? You said 3,700. A reporter wants to know, was that just the Indianapolis area or was that a statewide number?
My understanding in that conversation is that was across the state. Of course, many of them in the Indy area. And at that time, that sounded like we would be in as good a shape as any place. And I think that was on a fairly decent percentage of the number of hospital beds across the state. I don't recall what the number totally was, but at the time, I said to myself, well, that ought to put us in a good place. Now we see what happened in New York City, and I'm sure that we have gone to contingency planning, and the governor has probably had the benefit of seeing what can happen elsewhere and what the resources might be. But my recollection, that was across the state.
Okay, what is it that you can do or what can be done about non-essential workplaces forcing employees to continue to work? A question that came from Southern Indiana.
So when it comes to non-essential versus essential, please get a hold of the state because they'll tell you if you think you're on the borderline. And I think what all businesses, essential or non-essential, and if you're non-essential, you basically are closing shop unless you can do something in a carry-out fashion. And that's going to be the hardest measure for anyone that owns a business like that to see if you come out even halfway intact when we get through this. If you're an essential business, you need to practice staying 5 to 6 feet apart. I had somebody say, I saw you on the Senate floor. It looks like you were staying 5 to 6 feet away from other senators, and I've tried to pay attention to all the things we each need to do as an individual. And then you see at the briefings, and many in my own chamber that weren't practicing what they preach. So I think as an essential business, since you're still going to be around the workplace, make sure that if you're sick or if you have any issues, and the employers make sure to say, stay home, take time off. We're going to work with you and practice even in the workplace, social distancing, so that we listen to what the experts say to tamp the disease down.
Question from Corrine Rose. With so many hospitals and ICUs near capacity to begin with, aside from asking the public to continue practicing good hygiene, what support and help would the federal government provide to other cities outside of Indy with necessary equipment? I think this speaks as well to conflicts about exactly what kind of personal protection equipment is available here in the state.
So when it comes to PPE, when it comes to states disproportionately impacted by it, we mentioned it earlier, the National Guard, even active duty, I think, need to be on call. And I know early on there was a little bit of a dust up between maybe New York City and some of the leaders in certain states not thinking the federal government was working in a doable way. I think that has changed, and you've seen both sides evolve to where we're all in this together. When it comes to prioritizing getting equipment in the right places, I think that we're over that hump. And when it comes to fully marshaling, what we've got more than probably any other country, and it looks like we're going to be contending with more cases than any other country, is we've got a unique private sector look what it did in World War II. And I think the analogy of this being similar to World War II is kind of what we need to do if we're going to get through it. And that means state and local governments, the federal government, and the private sector. And as long as we're all hands on deck and we're working with one another and not bickering about the things where it's not getting along correctly, we're going to get through this. But I'm for throwing everything in the kitchen sink at it, because the sooner we get the numbers in the corner of the screen down, you're not going to have people resting more easily about how we come out of this on the other side.
Okay, last question. I will remind everybody, thank you for participating. We will be posting this to the Indiana Broadcasters Association website for those who wish to record it or play it back. A two-pronged question again. This one is economic. What sort of long-term changes might come from this, such as paid leave policies or unemployment revisions, more investments in public health? And when we're all said and done, do we have any idea how we're going to pay for a multi-trillion-dollar series of packages?
So let's take, first of all, the question of what we learn about how we'll do things differently. I think that we're going to learn a lot about what to have in place because this is going to happen again. I mean, we had MERS, SARS, Ebola, which scared everyone, even though that didn't transmit as easily. Had H1N1, where we actually lost 9,000 to 10,000 people back in 2009. So we are going to be better prepared. We're also going to have policies in place. And whether we do that as a federal government directive, or whether businesses and state and local governments, probably do what's tailored to their area, I think that I would lean towards the latter. I've been there only a little over a year, and I was a state legislator for 3 years, school board member for 10 years. We do things more effectively and more efficiently from the grassroots up rather than a centralized top down, even though you need to do both things, especially in a case like this. The bigger question, how do we pay for this? I've been talking about that since I've been there. And sadly, most of my cohorts in the Senate and most U.S. representatives have kind of baked in $1 trillion deficits, shrug it off like it is not going to have any consequences in the long run. I actually believe the federal government and governments should be in a place through rainy day funds and emergency funds to where you're not borrowing, even in this case, from future generations. So hopefully we'll not only learn about how to save towards that rainy day and for emergencies, but we'll also get some fiscal discipline out of this so that we can get the embarrassment of running $1 trillion deficits on $23 trillion in total debt back in line to where we don't put all this burden on our kids and grandkids.
Okay, Senator Braun, thank you so much joining us from Jasper. Again, this will be available for replay from the website of the Indiana Broadcasters Association. Thank you for joining us today. Have a good day.
Thank you.